We'll be starting in about 2 minutes. Good afternoon, everyone, and thanks for joining us for our media and public update. Tracy, do you have some introductory comments before my opening comments?
I just want to say we have members of the executive team. We have Stuart Spillman, Environmental Director, Laura Woodrum, Director of Nursing, Dr. Wayman, our Medical Director, and Sean Crabtree, our Executive Director, who's going to be answering questions today. I do want to remind everyone that if you have a question, please type it in the chat box and we will get to that question as we walk through the discussion today on COVID-19. Sean, do you have some updates you want to share?
Yeah, I will give us some case updates for the week. I'll be looking away at the screen, so you'll be seeing a side view here. We have, in Adair County, we have had a total of 96 cases. There are no active cases right now. 77 are recovered, 19 deaths. In Casey County, we have had a total of 2 cases, both recovered, so no active cases. In Clinton County, we've had a total of 3 cases, all are recovered, so no active cases. In Cumberland County, we've had a total of 5 cases, all have been released or recovered, so no active cases in Cumberland. In Greene, we've had 1 case. That case has been released from isolation or are recovered, so no active cases in Greene. We've had 13 total cases in Macquarie, all are released or recovered, and so no active cases in Macquarie. In Pulaski, we've had a total of 56 cases. 51 of those have recovered, 2 deaths, and so that leaves 3 cases right now that are active in Pulaski. 2 on home isolation, 1 in the hospital. In Russell County, we've had a total of 23 cases. There's been 4 deaths, and 18 have recovered. We have 1 case in Russell right now that's still active, and that person's on home isolation. In Taylor County, we've had a total of 11 cases. 8 of those have recovered. 3 are still active, 1 in the hospital, 2 on home isolation. In Wayne County, we've had a total of 8 cases, 8 recovered, so no active cases in Wayne County at the moment. So for a district-wide total, we've had a total of 18 cases, 25 deaths, 186 have recovered. We have 7 active cases in our district right now, 5 on home isolation, and 2 that have recovered. So for my opening comments, I was thinking back over the outbreak over the last 7 weeks, and you know, we've seen some very positive things and we've seen some very negative things. What I mean by that, on the negative, we've seen how devastating this disease can be. We saw an outbreak in a church, and we saw an outbreak in a long-term care facility, and those were both very, very difficult situations. But we've also we've witnessed some positive things. We've seen positive cases in other long-term care facilities, and we've seen positive cases in businesses, factories, And, by catching those cases early and quarantining the cases and the close contacts, and by the proactive efforts from the facilities to take precautions, to social distance, wear masks, create barriers, whatever things that they needed to do to keep their workers, clientele safe. So we've seen several instances where the disease has been contained in both businesses and long-term care facilities. Now, I'm saying all that to say precautions work. When you're taking the precautions, they work. And my fear is right now as a society that we've become complacent. And, the economy's starting to open back up. People are starting to get out and mingle around. I've been to a few stores in the last few days. I've seen, in some instances, there might have been maybe 10% of the general public in the store that was wearing a mask, and maybe at another store there may have been like 60%. And wearing a mask to protect others from you, you can have COVID-19, of course, and be spreading it without even knowing you have it. So wearing the mask to protect others from you, if you have it and don't know it, is a really important precaution that, as a society, it doesn't seem, at least locally, that we are being, as a people, as proactive in that area as we could be. The businesses in our district, it seems like are by and large trying to follow the guidance. There are some instances where some things are being missed. We are going to, over the next couple of days, personally deliver guidance to every business in our facility, reminding them that the businesses have to comply with the guidance. And so we can at least do that. What we can't do is we can't make the general public wear masks when they're out. We can't make the general public stay home if they're sick, of course, unless we find out they're a positive case, and then we can quarantine them. But so we really do need the public to be part of the solution here, to stay home if you're coughing or have a fever, to wear a mask when you're out, to avoid crowds, to wash your hands thoroughly and frequently, to increase your sanitation. If you can do those things, we can hopefully prevent this another spike in our area of this disease. And don't be mistaken, this disease is still with us. We've only had 218 positive cases. That's a very small percentage of 200,000 people. And the virus has a long way to go before it's worked its way through the population. And taking those precautions are important. So I'll stop with that as far as my introductions, Tracy, and I'll turn it back over to you.
Okay, so we're going to start with the questions, and the first question is for you, Laura, and it's regarding testing. Will there be other testing scheduled after a county has already had one scheduled? And then also, how long will it take for the results to come back, and how will someone be notified regarding their test?
We as the health department haven't done testing. We've participated and partnered with some planning of testing and some other testing efforts with local providers and emergency management. The clinics that we've assisted have used the Gravity Lab, and they have, to process the test, the turnaround time is around 48 to 72 hours. The provider of the test will notify the patient of the results. There may or may not be more mass testing scheduled in our 10-county district. Whether it be mass testing or not, there is testing available in all of our 10 counties, and those testing sites can be found, and you can filter to your county on the KY COVID-19 website.
Okay, thank you, Laura. This one, I guess, is for you also. If a person is tested at a doctor's office or emergency room, are they to isolate themselves until the test results come back?
If a person is tested because they are symptomatic of COVID-19, then yes, they should isolate themselves. if they're tested just to be sure and they've not had any known exposure or aren't having symptoms, then no, they wouldn't need to do that.
I would assume the healthcare professional would tell them that too, Laura. Is that right?
Yes,
Okay.
yes, they would need to follow the guidance that they were given when they received their tests.
Okay, thank you. Stuart, I think this one is going to be for you. Is the health department still monitoring businesses that are open for social distancing? And do we call the health department if we see that businesses are not practicing, I guess, the guidelines?
The short answer to both of the questions is yes. Yes, we are still monitoring for businesses that are operating for social distancing and for masking. And you can call the health department with complaints. You can call your local health department, or you can call our complaint hotline. But there's a wider answer, of course, that even though we are monitoring these businesses for compliance in both masking and social distancing, and the businesses have been able to put controls in place to help with crowd control, but ultimately it is going to be up to the public that's visiting the business to social distance themselves, to take care of themselves, to not expose other people or be exposed by being too close to people. Also, it's up to that customer to wear a mask. We know that masks are recommended for the general public. They are required for employees. They're recommended for the general public. And remember that masking, when you wear a mask, you're protecting me. You're not only protecting me, you're protecting those that are vulnerable in our society. And when they wear a mask, they're protecting you. So vulnerable people, they still need to get out, and they still need to go grocery shopping. They still might need hardware supplies. They still want to be able to attend church services. So we encourage people to be good neighbors and to protect, even though you may be totally healthy, protect these people that are not as healthy as you are by wearing a mask. We are going to be, again, as Sean said, we'll be sending our employees out this week over the course of the next week, to take the minimum requirement guidance out to the businesses again, to remind them that their employees are to be wearing masks, to remind them of the minimum guidance as far as sanitation goes, and setting up their social distancing. But ultimately, we as the community, as the general public, we have to be able to accept this responsibility on ourselves to protect our own selves and protect others in our community also by doing these things such as social distancing and wearing masks.
Thank you, Stuart.
Tracy, I see a question in the live chat, and I will remind, we have, looks like 46 people watching live. If you are watching live and you have a question, you can type it in the chat and we will answer it if we can. The question is, and I'm going to direct this to Dr. Wayman. It says, how readily available is the antibodies test across the state, and where can someone get this test? At the health department, private physician, hospital? And also, if you might add to your answer, the reliability of the antibody tests.
I don't know the answer to the first question. I know that private providers can send off the test to a private lab like LabCorp or Quest, which are the two labs that are being used by private providers in our area. So probably anyone can receive one anytime they wish. It is not a very reliable test, and each one has a different degree of reliability. So it just depends which ones are being used. They are not very reliable in the context of low incidence of the disease in the community, which is what we have. We probably have less than 1% people infected in our area in all the 10 counties. I have one. So if someone has not had symptoms compatible with coronavirus, then they're more likely to have a false positive result than a true positive. It is not the first line of being tested at this time. Anything to add?
No, I know on the governor's webpage, there's a list of every place that's providing testing. Some of those testing sites are doing antibody tests and some are doing the swab tests. You know, I know people are frustrated when we don't know the answers to some of those questions, and I apologize for that. I can only tell you again that the environment of testing is changing daily. The types of tests that the providers are providing may change. You know, it depends on how much of the material they can get, how long it holds out. So, you know, some places that's testing one week may not be testing the next week, and a new place may go on. You know, check the governor's website, the Kentucky COVID-19 website to find testing locations, and just call and check and see which type of testing they're offering, if that interests you. So I wish we had a better answer, but at least on the Kentucky COVID-19 website, that information is, at least testing sites is listed now. So that's probably the most reliable place to find testing locations. And again, I remind everyone, if you have a question, go ahead and type it in the chat. There was 3 questions we pulled off social media that I'm going to try to answer, and if I don't answer them sufficiently accurately, Dr. Wayman can correct me, so she's here with me. One question was, how is it that we can list someone as released on our daily reports, yet they still be in the hospital? And it's entirely possible that someone can be released or considered recovered, meaning that they're disease-free, that they no longer have the virus. But they can still be in the hospital for other issues, or they could even still be in the hospital because there's lasting health consequences from having had the disease. And they may still be in the hospital because of a complication from having had the disease, even though at the moment they're disease-free. So it is possible to be released and to be free from the virus, but to still be in the hospital for complications associated with the virus. So that's one answer. I'm going to skip over to the chat questions, and then I'll come back to these social media questions. It says, just to double check, masks are a requirement for staff as well as social distancing between the patients. About waiting rooms, should they be empty or just have people apply social distancing? Thanks. Again, I'll make a stab at this. Or Stuart, why don't you just answer it? You're probably more versed in that than I am.
Okay, so yes, masks are requirements for your staff. Masks are, again, they are heavily recommended that your patients would come in wearing those masks. You are allowed as a facility by law to require them to wear a mask when they come in. Your staff, this is going to get a little bit into answering another question from Judge Green in McCurry County, who asked about the courthouse opening up on Monday, June 1st, and our mask temperature checks required for county employees and those entering the courthouse. So no matter what type of facility you are, the masks are required, temperature checks are required. Temperature checks can be self-administered, but they are required. So yes, on both those things. Masking of the public coming in, highly recommended. You as a facility or as the county government, you can require that people who enter are masked. Also, One Cross Health had asked about should the waiting rooms be empty? Yes, there has to be an alternative waiting room. So What that means is now you're doing something where you, the patient calls in for an appointment, they call and let you know that they're there, and when it is time to bring them to the back, you would call them on their phone, or maybe you give them, they can come in and get a buzzer or something like that, and they would wait in their car until it's their appointment time. Any business, even there at the courthouse, you know, if people are coming to get their car license, they could also do a system like that, because we have to limit the number of the capacity, the number of people in a business. Most businesses are 33%, so a third. So we have to do that limiting. We have to still ensure there's social distancing between whatever patrons in your business. But of course, if you're any facility that has a waiting area, then you have to go to a non-traditional social distancing. Just social distancing would not fulfill that requirement. You have to do the non-traditional waiting, such as out in the car.
And I'll add, Stuart, you know, right now we have 7 active cases in our district, and that don't seem like a lot, and it's not a lot compared to, relative to a population of 200,000. But during a pandemic, 7 can turn into a whole lot more very quickly. And there's probably, you know, a number of people out there who are asymptomatic, and it may be spreading it without even knowing it. And the number of known cases can really jump. You know, we're very hopeful that, you know, people are taking all the precautions, and that this thing's going to continue to grow very slowly, and we won't have a spike. But, you know, there's a good chance we will probably have another spike. Let me swing back around to the question that was asked earlier about being released and still in the hospital. Dr. Wayman, was there anything you wanted to add to my answer?
No, I think you pretty much covered it.
Okay, all right. I just wanted to make sure I got it accurate. Okay, and on Facebook, someone answered, all right, thank you. So another question that we got off of social media is, how is it that we can, in our daily reports, add a new case to our total case count, but the active cases doesn't rise? So how can we add a case and release the case at the same time? There's a couple of ways that can happen. One way, which was happening more early on and doesn't happen as much now, was that sometimes the testing results didn't get back from the lab quick enough. And somebody could have been tested maybe a few days after they were sick, and then the testing was sent to the lab, and the lab didn't get it back. And by the time we get the results back, they've already been symptom free for 3 days and 10 days since their symptom onset, and they're qualified to be released. That doesn't happen as much now. The turnaround time on the testing has gotten better. There are people who now are getting the antibody test to determine if they've ever had it. And as Dr. Wayman said, though we don't consider those tests to be extremely reliable, if those results do come back positive, we consider them positive. We treat them as if they are. But maybe they thought they had the disease back in January, or maybe they thought they had it back in February. Well, you know, they're a positive case because the test says they've had it, but they haven't had symptoms for a long time. So they would be added as a case to our total cases, but they wouldn't be added as an active case. So they would be basically released the day we added them. Does that sound right, Dr. Wayman? All right. And again, I remind everyone listening in, if you have a question, feel free to type it in the chat and we'll answer it if we can. Another question on social media is, and I think this more comes from Adair County. You know, Adair County had a very large outbreak in their nursing home there, and along with several other facilities in the state that was hit early on before we really started pushing the guidance and stuff. And anyway, it got into their facility really pretty deep before, I think before they knew they had it. And it's been a difficult situation, not just at Summit Manor, but at several long-term care facilities across the state, and prisons and different places that got it in there. But the question is, on our daily reports, we have it listed that there's no active cases in Adair County. But the nursing home there will release a daily report that says they still have active cases. So why does our report not line up with their report? It's because we're using two different criteria to release a case. At the health department, we use what the CDC would call the non-testing criteria, which means once someone is disease-free or no symptoms for 3 days without any fever-reducing medicines, if they haven't had symptoms for 3 days, and if it's been at least 10 days since they had their first symptom, we consider them recovered and we release them. The nursing homes, not just at Summit Manor, but nursing homes all across the state, may well be using a different criteria. There's also a testing criteria to release cases, and this may have evolved some in the last few days, but it was 2 negative tests, and it may be just 1 negative test now, but it at least was 2 negative tests. And I guess if I was in a nursing home, I would want to use the 2 negative test criteria to be safer, but they certainly don't have to. You can use either criteria to release a case. So, they may show that they have cases a little longer than we do because they may be waiting a few days to administer a second test and to get those test results back. So they'll have 2 negative tests before they release. Does that sound right, Dr.?
Sounds right.
Sounds about right. Okay. And I don't see any more questions in the chat box. Stuart, do you have any other things to add?
I do. I want to go back over some of the differences in masking, just because I still get questions where people don't understand. So when you're out in the community, most people are going to have a cloth mask of some sort. We have some of the stylish kind of masks that I see people wearing now, black, different colors, or a surgical mask. And the other type of mask is a N95 respirator, which those masks are not widely available at all in the public, and those masks have to be fit tested. So what that means is when you put that mask on, you try that on, and they're going to put a hood over you and put some kind of scent in there that might choke you, or that you're going to get a tickle in your throat. And that when if you don't breathe that mask is fit to your face, and it's made out of a certain type of filtration material. The mask that the public has, all these masks that we see out there, the masks that you have as the public, these masks are meant to contain what comes out of your mouth. They protect the other person. And then by them wearing a mask, that protects you. N95s are the only kind of mask that can protect you from what somebody else is breathing. That's the only kind. Those masks are not widely available. You're not going to be able to really find those masks. So what we're asking people to do is wash their hands, keep distance, please wear the mask. Even if you're healthy, if you think you're a strong person, I mean, we beg you, wear that mask to protect other people. It's not just about your health, it's about other people's health. And we want to be able to move past this thing. We want to be able for everybody to be open and us do the things, get back to the life that we want. And if it's just a little inconvenience of staying, not grouping up in mass gatherings, not, distance yourself from people and wear the mask. That's all it takes for us to be able to move past this, to hopefully get a vaccine and to be able to move on with our lives. So if from the people who are healthy, if we have to inconvenience ourselves just a little bit for our fellow man that's more vulnerable, I think we can do that. And we just asked you to consider that and to do that.
Thank you, Stuart. Dr. Wayman or Laura, do either one of you have anything additional to add?
I don't.
Tracy, do you have anything or any more questions on your end?
I do not.
All right, and, like Stuart, I want to reiterate what I started with, that, we've seen situations in our district where absolutely taking precautions has worked. We've seen positive cases in nursing homes, positive cases in factories where, we caught it early and we did the case investigation, the contact tracing, we quarantined and isolated people, and the facility took all the right precautions to contain it. And we've seen situations in our district where, we'd had the church outbreak and the nursing home outbreak there in Adair County, which, didn't turn out as well. So, we want to say precautions work. So as Stuart said, please observe these precautions. Avoid the crowds, wear a mask to protect others, wash your hands frequently. I did see on the CDC website, they had released a story saying it's difficult to contract COVID-19 off a surface, and they've backed off that a little bit, and they've changed the story or changed the wording of what's on their website to suggest, yes, it is possible, though it may not be a real effective way that the disease is spread, but it is a possible way. So do sanitize and wash your hands. Don't take those chances. Stay home if you're coughing or have a fever. And I guess that's all I have. Anyone else, any closing comments? All right, Tracy, I'll turn it over to you for the wrap up.
I want to say thank you all for joining us today. If you have questions, please send those in to us, and we will be back next Wednesday, same time, to answer questions and share updates. Thank you all. Have a good day.
Thank you all.